Record.
And go ahead, Ralph, then Sandra.
Hey, Greg, good evening.
Hey, how are you?
I'm doing pretty decent. I would like to get some poplar balsam specifically to inhale. And I was wondering if I got the poplar balsam spray, would it work for that application?
Yeah, it could work for that. You have there's alcohol in it because it's a spray. And so there will be a little bit of the alcohol smell, but it's a good inexpensive way to be able to get it, spray a couple times in your hand and just kind of do it like that.
Okay.
Yeah, that would be good. Yeah, sure.
Excellent. Thank you.
Yeah, like we try to come up with ways of like making it inexpensive. It's an expensive oil. Like the thing is there's also a bunch of like adulterated versions of it on the market, and so we try to come up with other ways of making it cost effective, and so the spray was a way to do it.
Okay, cool.
It's a way to get a lot of bang for your buck. So.
Yeah, excellent. Yeah, and I got my oil set for the seasons class in, so I spent the weekend going through it.
Nice.
Friday I did spring, Saturday I did summer, type of thing. So that was quite like it was nice. It was much more gentle to go through it day by day, like
with time. Yeah. I would agree with that.
But anyway,
like sometimes when I'm doing the classes, like I have to kind of temper, like we're going to be doing this in one weekend. Like it needs to be like achieve the goal, but at the same time not be crazy over the top intense. And so,
Okay, thanks.
Yeah, enjoy that. Yeah, that's a really super powerful class. Like that's one I go back to quite a bit.
Yeah, well, I'm gonna. Yeah. Some of the things in there you talked about, I'll definitely be doing it. Once a week for a few weeks, and break some new patterns there.
And even just for like tune-ups, there's the seasons themselves. The spring and summer and the solstice and equinox. But like if you just want to do a tune-up in between, just do the 4 blood oils. Like in between. It's they're powerful just by themselves.
Okay.
Yeah.
Thank you.
You're so welcome. Enjoy.
Okay.
And then go ahead, Sandra, then Cynthia.
Hi, Greg.
Hey, how are you?
I just wanted to tell you that I gave a friend, Prenny Keeler, as a small gift, your hyssop salt scrub, and she just loved it.
Oh, good.
And that brings me to my question. As she was using it, and she was rubbing it all over her body, she said her lungs, she has a breathing problem, so her lungs opened up and she could breathe clearly. And she was thrilled about that. And she, knowing that I was taking classes from you, she asked me if I could recommend essential oil for her. And of course, the first thing that came to mind was hyssop, but there are many types of hyssop. But I just wanted to tell you, her main problem is a cough that she's had for 3 years. It's a spasmodic cough that came from having bronchitis about 3 years ago. She's been to doctors. They say her lungs look wonderful. So why does she cough all the time?
Yes.
I just wanted to also mention that she says when a long inhalation, like you get ready to do om or balanced breathing, really sets it off.
Yeah.
So and my husband has a similar problem, so I'm trying to heal 2 birds, I guess.
Yeah, so it's actually a very common problem, and if you look at coughs can have a lot of different like causes. The thing that we always think about is, is there mucus, is there spasm, like bronchial spasms, things like this. There's actually a thing in the vocal cords that can cause a cough. It's not very common, but it can happen. A lot of coughs can happen from digestive issues, especially in the stomach itself, not just the abdomen, but like the stomach. That actually can cause a cough. There's issues and tension in the transverse colon, or is it transverse colon? Large intestine. It's the large intestine that can cause a little bit of a cough. But spasmodic cough is actually, there's a muscle in the neck that actually has two parts, and they both start from the base of your ear, and there are those two rope muscles that kind of come down your neck, and one attaches to the sternum, and then one to your clavicle. And so it's called the sternocleidomastoid. And so mastoid being back here, and then sternum and cleido being the clavicle. And so it just is kind of like reference there. And so when that goes into spasm, it actually, the byproduct of it, or spasm's not always the right word, you actually can develop what you would call as a trigger point, which starts to cause a little bit of some neurological dysfunction. And so when that happens, it actually, the byproduct of it is spasmodic cough. It's not a cough that produces any mucus. It's actually not even respiratory related.
But she does cough up things.
It does cough up some mucus.
Yeah, we've both scanned that she has not an active infection, but she has some bacteria in her right lower lobe. And she says what happens, she'll cough for about 2 or 3 minutes, violently. And then 5 minutes later, something comes up. She said it's usually white, not, yellow, white, like you would expect. So it makes me think that, could it be that this residual bacteria that's just sitting there is causing that?
Yeah, I mean, it could be that there's some, let me think that out for a second here. I mean, it could be that there's some mucus down there that the body's trying to get rid of. It could be that there's a little bit of a spasm down in the lower part of the lung tissue. That's always an issue, that it's producing something is, Well, we can approach it like this, because one of the things that the sternocleidomastoid does is it elevates the rib cage during respiration. So a lot of times why that ends up becoming a spasmodic cough is, usually a really bad bout with like sinuses. It could be like bronchitis, or just like a chest cold. It could be just even being in the cold and having to strain, like, say you're walking upstairs or something. Sometimes it's a little bit of a neck injury or the way that a person sleeps. So there could be a lot of reasons, but the way to treat it is also the way to treat other respiratory issues. And so this is like, there's probably 2 or 3 things that we'd like to approach here. Does she have any anxiety?
No, I don't think so. No, she's
Okay.
a pretty calm person.
Okay, because sometimes, like, if the breath starts to get short and rapid, it will actually produce a little bit of anxiety or anxiousness. And so if we're not concerned about there being short, rapid breath, so there's a couple of things that I'm just going to talk out, and you might even need to do a little bit of a combination of them all. But so right off the bat, I would probably, hyssop is a really solid choice. I would probably lean a little bit more towards hyssop decumbens.
Okay.
And the reason being that it's a little bit better antispasmodic for the diaphragm and for the sternocleidomastoid, and also just for the lung tissue itself.
Okay.
And so it doesn't quite have the cleansing effect that regular hyssop would, like etherically cleansing. But for respiratory issues, it's actually a little bit more solid. And when there's mucus in the lungs, things like that, even in the sinuses a bit, but more like lungs and bronchioles, hyssop decumbens is a really solid choice. A really solid choice. You could potentially use larch, either with it or instead of. Larch, kind of the same thing, good for mucus, good for spasms in the bronchioles, good for spasms down in the lung tissue, even the lower lungs. And both of those will deepen the breath. And so when you deepen the breath, that usually means the diaphragm is starting to open up. The diaphragm is starting to open up, and you're starting to hit more of the lower part of the lungs.
Okay.
A lot of times people tend to use more of the upper part of the lungs when they're breathing, and they're not really utilizing the lower lung tissue. You know, it just sometimes it's skeletal muscle, sometimes it's habit, sometimes it could be posture, it could be all kinds of reasons. But you start utilizing more of the lung tissue. Both will break down mucus. If there still seems to be a mucus issue, you have two ways that you could handle that. And I would probably, one is the best mucolytic that there is, essential oil wise, and even in the herbal world, is Anula. Now, Anula can be a little bit pricey. It does work really good, but one of the things that I usually have people do instead of Anula right off the bat is there's the oil that is made from pine wood, and it's called terebinth.
Oh, yes.
Yeah, terebinth
Sort of that.
terebinth is really good for drying up mucus. I mean, it's like the Anula kind of breaks it up and helps you to expel it, and the terebinth just kind of dries it out.
Okay.
You know, and so it works really super good for that. And so if there's concern of like a lot of moistness, a lot of mucus, like if there's some wheezing, anything like that, terebinth can be a go-to thing with something like that. And good thing is it's inexpensive and it's real gentle on the skin, so she could inhale it. She could put a bunch of it on her chest, and you know, like even neat, and just put a whole bunch of it. There's been times where I've put like probably 10 mils on the skin, just on the back, because it also opens up like soft tissue and things like that. And it makes the body feel nice and comfortable. And so, I mean, just maybe 6-8 drops on the chest would be probably pretty good for her, but like also doing some deep inhalations. And the good thing is it's really super inexpensive. So she could use a lot of it. She could use it for other things, but it's really solid for drying up mucus.
Okay.
The other thing that I always kind of take into account with respiratory issues is a couple of things. There could be a little bit of inflammation, and there could be more tension in the respiratory tract than we realize. And so the inflammation, you could use forms of like chamomile, but I tend to go right for the helichrysum. Like I use, just have them inhale helichrysum. And then sometimes just to calm down like relax the lung tissue, spikenard. And so here's the thing that you could look at is I would do the hyssop decumbens, and I would probably explore the terebinth. And then that last part that I was talking about, we've pulled it together with a lot of those components into one blend called Breathe Easy.
Oh, okay.
And that way you don't have to buy all the different pieces to explore it. We put it in a roller ball so she can just like kind of roll it on her nose and a little bit on her chest and everything like that. And it slows down the breath. It calms the lung tissue. It has a little bit of the larch in it. It has a little bit of the Anula in it as well. You know, it kind of hits all the points. It's really good for reducing inflammation, and good for like maintenance with lung tissue and dealing with things where there's inflammation. I would still use the hyssop decumbens or larch with it. And I would,
Terebinth?
Yeah, the terebinth, I would kind of like that she has a cough that's producing something, you know, and it's been there a while. going to want to knock that out. You know, like the longer that that's there, the more potential you have for an infection. Because like the thing that I always kind of use as a rule of thumb is if there's a lot of excessive mucus in an area, that's a bacterial infection waiting to happen. Like that's always a breeding ground for bacteria.
Okay.
And so I would just knock that.
Do you have any oil that would suppress a cough when she needs to suppress it? One of her problems is she has a hard time, you know, doing these breathing exercises because it sets.
The breathe easy should help. The decumbents should help if it's diaphragm related. But the sometimes the things that you can use for that is like the spikenard, like having them inhale spikenard, because it's calming and soothing to the smooth muscle. And you could be dealing with just tension or like spasms in the lung tissue. You know, you always want to look at the bronchial spasms. You know,
Right.
the hyssop decumbens and the larch, all of that should really start calming down the bronchial spasms. Now, the other thing that you can always have her do as well, if it is a bronchial spasm, one of the ways to check is to have her inhale very slowly, where she goes, and then, you know, say it takes like 15 seconds to inhale, right? And then have her try to exhale slower than she inhaled. And if she has bronchial spasms, she'll just go, like
Right.
it'll be really quick. Excuse me. It'll be really quick.
Mhm.
But if it's fine, she'll be able to do a long, slow exhalation. And so if that's the case, you can have her do what's called pursed lip breathing, which is, you know, inhale through your nose and then make your lips really tight with just a little tiny hole where you have to force the air out.
Well, almost like a
And that-
whisper.
Yeah, like you're kind of trying to like forcibly whistle. Yeah. And so you like, and that will actually manually open up the bronchioles.
Oh, okay.
And so if that's an issue, I mean, a couple of sessions of that, along with the oils that we've talked about, it will knock it right out.
Okay.
Yeah.
So can I ask you one more thing?
Sure, of course.
My husband has a similar thing, but I think he has an active infection. That's what I scanned in the right lower lobe, and he hasn't run a fever, but he gets up when he coughs. He gets up a lot of stuff, and it's been going on now for over a month.
I would
Oils that
do-
would be antibacterial that you could recommend?
So, like, and we think it's been there a long time.
Well, he's been coughing, I'd say maybe 4 to 6 weeks now.
Okay.
Not like real long.
So yeah. So the thing that I would say is the oils that we just talked about, I would use on him as well.
Mhm.
The one thing that I would add is whenever we think that there's like a chronic infection, I would go to Moroccan thyme.
Okay.
And yeah, Moroccan thyme is really solid for, because what can happen is there can be like low grade bacterial infections that the body's not really fighting off because they're low grade, but they're still causing a problem, but they can just linger for a long period of time. And so, you know, anytime there's an infection in the respiratory tract, you know, you can go to any form of thyme. When you're doing something where you're treating it quick and fast, you go to like a red thyme or a white thyme. When you start doing a little bit more long-term treatment and trying to strengthen the body, you go to like thyme thulianol or geranol, something like that. When you're dealing with a child, you would do thyme linalool. Like the magic bullet in the thyme world is for like infections is the thyme benchmark. It's like a fancier form of thyme. But I think when you have more of a chronic infection, the Moroccan thyme seems to work better for something that's just been there for a really long time. I mean, I've used it to treat low grade like kidney infections, and I mean, just knocked it out with like a couple weeks of treatment.
Okay, would you?
That would have to be internal though. Like that would have to be like 2 or 3 drops in water and drink it.
Okay.
Yeah, and like daily.
Okay.
Yeah.
All right.
And so it's anti-inflammatory, and it will, you know, help reduce any sort of infection if it's present. And worst case scenario, if there is no infection, it just makes the body stronger and it's reduced some inflammation for a while.
Okay.
So, I mean, it's kind of a win-win.
All right.
Yeah. The other thing that's nice with time is if there's been like a buildup of mucus in an area, it helps to make it like more fluid so that you can expel it out
Okay.
when you cough.
All right.
Yeah.
All right. Well, thank you so much.
You're so welcome. Keep us posted on that. Like,
Okay,
you
I
know,
will.
sometimes we need to troubleshoot some things. And so that approach is pretty solid, but if there's some variations that we need to do, we can do it. But like that should be pretty solid.
Okay. All righty. Thank you.
You're so welcome.
And then go ahead, Cynthia, then Linda.
Hey, Cynthia.
Hi, Greg. Hi, Samantha.
Mhm.
I have we have the old house in Mississippi that where I go when I'm not in Louisville. And so the very first day that we got this house 20 years ago, I asked where to buy plants. And so I went, and I've been friends with these people ever since. And their daughter, I went to see them last week, and I knew this was going on, but it occurred to me that there might be some oils. She's 33 years old. She had a brain tumor and was having seizures, and she had surgery. It'll be a year in June. And it's in the frontal lobe.
So the surgery for the seizures?
No, I'm sorry, for the brain tumor
For the brain tumor. Okay.
in the frontal lobe.
Oh.
And so
Right.
I have photos of it after the surgery and now that I could send if it would be better to do that this way. She's wanting to do things holistic.
Okay. And so there's not really a lot that they can do other than chemo or radiation, or they're not even wanting to do that.
Well, no, they want to, and you know, this is South Mississippi, and so they're saying, no, you have to do that. And she's saying, I'm not doing radiation, and I'm not doing chemo. And so what she's been doing is she takes Keppra and ox carb for the seizures, lion's mane mushrooms, reishi mushroom, pure graviola, iron because she's bruising easily and very pale, vitamin C for her immune system, zinc, potassium, L-theanine for sleep, organic Newman's special blend coffee plus RSO oil. I think it's the pure tincture of THC. And then she's doing CBD oil and
Right.
THC.
Right. So
And
she's
it hasn't, go ahead.
So she's bruising real easy?
Yeah.
Most likely that's a vitamin C deficiency.
Okay, because I was wondering about the one that you recommend.
I would put her on pretty big dosages of quercetin.
Okay, I was wondering about that.
I mean, it could be iron, but more times than not, it's actually, is it a lot of spontaneous bruising?
I don't know.
Yeah.
I'm not sure. And she's had a hard time here. She had a hard time even getting another brain scan because all the doctors want her to be doing chemo.
Yeah.
And so they won't touch her. And so she finally found somebody over in New Orleans. We're about 50 miles from New Orleans. And so she did it, and it has not grown. And
We'll
I have pictures that I could send if that would be helpful.
And was it a malignancy or was it benign?
I think it was benign,
Okay.
but you know what?
And-
I don't know.
Yeah. Yeah. Like, so I would say let's find out if it was malignant or benign. I mean, it kind of, in a way, it almost kind of doesn't matter because it's in the brain, and any growth up there is bad. You know what I mean?
Yeah.
There's not space for it. And so, you know, bottom line is you got to restrict the growth. But regardless, sometimes if it's a malignancy, the treatment could be a little bit different. And then when they described it, did they say the borders of the tumor were well defined or poorly defined?
I don't know. I'll have to find
Okay.
out. Could you tell if I send you the pictures later?
Probably not. Like
Okay.
I'd have to see like some of the terminology that they used.
Okay.
The thing that we'd be looking at is if it's inflammatory in nature, or if it's well defined, it tends not to be quite as inflammatory. And the reason is if it's inflammatory, it has like these little roots that kind of fire off and go into different directions. And then it will fluctuate in size. You know, will puff up and go down and puff up and go down. And so that's a little bit of a different, that tends to be more of an aggressive tumor in my experience. And that would be helpful. I mean, she's doing a bunch of things that seem like it would be pretty straightforward. Different oils can have an impact. With something like this, I'd probably use pine oil, like probably like Sylvester pine or Sylvester or Scotch. You know, either way. I mean, they're just basic pine, but in big dosages. You know, put it directly on the skin. Doesn't have to be in the area like on the head. It could just be a bunch of drops in the wrist and maybe a few drops on each side of the temples. And depending on if it's inflammatory or not, I might adjust the mushrooms that she's on.
Okay.
Reishi is pretty solid. Lion's mane is always good for the brain. Helps to detoxify the brain, helps the brain to recover from you know, toxicity issues and things like that. Reishi is good, but Mataki tends to be better for like general trying to reduce the tumor growths. But like, here's the thing that I would say about that. If she's doing this regimen and there's been no growth, I hesitate on tweaking anything because she's getting some results. You know what I mean? And so like I would leave her on the things that she's on and just maybe augment it. She's already on a bunch. The thing I would do is I would increase the C, you know, do quercetin. Like, you know, she needs to really bump up the C.
Like how much?
Probably three tablets, like 3 to 4 times a day.
Okay.
Yeah. And for a while, you know, that's probably, you know, unless you just can't tolerate it, for a while. And the issue is like there's certain conditions that consume a lot of vitamin C, and when there's tumor growth present, regardless of benign or malignant, there tends to be kind of going along with that vitamin C deficiencies, you know, and it's not necessarily that it caused it, but sometimes when the body is fighting things off, it consumes and uses a lot of vitamin C, and there's just, you know, it's not enough in the body. You know, you can only store it for so long, and the body doesn't make it, and so vitamin C issues can be substantial, and could be that the iron it could be an iron deficiency. Did she get tested for anemia or anything like that?
I don't know. I'll have to find out.
Yeah, see if she got tested for anemia. But the issue is if she doesn't have an iron deficiency, if she doesn't have anemia, taking a bunch of iron probably will make her more uncomfortable than anything. And, you know, because it can cause like constipation and things like that. If she doesn't need it, that might be one thing that she could have go away and try to augment with the C. Yeah. But a lot of times in those kinds of situations, my experience is it's been more of a vitamin C deficiency than an iron deficiency, unless there's anemia present. Yeah.
Okay.
And so the pine oil, and if it's an inflammatory tumor, I usually put them on chaga. And chaga, it's another kind of mushroom.
Yeah.
But only if it's inflammatory.
Okay.
If not, I would just maybe augment with maitake.
Okay.
Yeah. The other thing that we used to do a long time ago is we would give them high dosages of maitake, and then we would give them kind of a significant dosage of digestive enzymes in between their meals, not with their meals, but in between.
Mm-hmm.
And the idea is that the enzymes actually break up the outer like surface of the tumor, and the maitake stimulates the part of the immune system that would fight off like cancers and things like that, and it allows the immune system to more effectively fight off the tumor site. And I wouldn't say that it would be a cure, but it definitely would stop. I've seen it stop tumor growth quite a bit, and even start to reduce them in size. You know, I've never seen it ever like completely cure somebody, but you know, she's got a lot of things going on. They've already done surgery. It could go into remission, and sometimes the body is able to fight these things off. You know, I would closely monitor that though. Like that's the thing is
Monitor the how
growth.
it's going. Yeah.
Like
Yeah.
from time to time, she's gonna. I mean, you know, the way that I always kind of tell like my patients back in the old days is like when you're dealing with cancer, it's not about like harmonizing the body or this or that. It is a bar fight. It is a full-on bar fight.
Yeah.
And you know, break a bottle and go after that tumor. You know what I mean? Like
Yeah.
you
And that's your
grab the nearest
personality.
bottle and just you
That's
gotta
cool.
really go after it. One of the things that we played with was we do this with viruses sometimes too, is like when you really go after a tumor or a virus, sometimes what happens is you know, because they're replicating, and you engage their survival mechanism and they start to replicate sometimes faster. And so you want to do things sometimes that calm and soothe the virus or the tumor so that it doesn't grow as much. And so if we know if it's a malignancy or if it's benign or if it's inflammatory, if the borders are well defined or poorly defined, that could help me fine tune what we would use to calm the tumor growth down. Pine oil could do it. Sometimes I use sweet Annie. Depends on what it is. We could use. Let me think about this for a second. How old is she?
She's 33.
Just as an outside like bystander, how are her emotions? Like not just right now, like through the last 10 years you've known her. She tend to be really emotional, not very emotional.
Probably pretty emotional. I'll check that
Okay.
out. with the
Yeah,
parents.
that
Things they have
that's
said.
what I was thinking too. Like
Yeah,
so the
She's
thing that I would
fiery.
augment is would you say fiery?
fiery.
Is that
Yeah, I
yeah,
think so.
fiery? Yeah. So let's do this. Let's you know, because this would make her more comfortable as well, is have her use tarragon.
Oh, nice. Okay.
Yeah, tarragon would be super calming to the emotions, soothing to smooth muscle, soothing to the issue where, you know, she's dealing with, you know, fighting this off and dealing with it. And it is one of the oils that you would potentially use to calm down like tumor activity. Like it doesn't like break down the tumor or reverse it, but it just can be something that slows the growth. And so, you know, a lot of times that's what we're shooting for. If you can slow it down, the body can actually start to fight it off a little bit better. And so you're allowing the body to fight more effectively. And so I'd say the two things, let's say three things: quercetin,
Okay.
the pine oil, and tarragon.
Okay.
Yeah, the tarragon
And
she
pine
can
oil is put
inhale,
on.
but I would say the tarragon would probably be best if she took 2 or 3 drops in water internally.
Okay.
Yeah.
And she's under gobs of stress because she has 3 young children and her husband is turning out to just be a jerk.
Oh, that's too bad.
I know. So the tarragon would help there too.
Yeah, it would be very soothing for all of that.
Okay.
Yeah.
Okay. And
Yeah.
so when I find out the answers to what you're wondering, may I email you?
Yes,
Then?
yes, please. Yeah.
Okay. Thank you so much. I really
You're
appreciate
so
it.
welcome. Keep us posted.
Okay, I will. Thank you.
And then go ahead, Linda, then Megan.
Hey, Linda.
There we go. Hey, Greg. I have been with you the last 2 weekends and it's been amazing. And
Good.
I've been working with each planet every day following the calendar. So
Oh, how's that been treating?
it's been great. And I also work with human design. So I've been weaving
Oh,
that.
tremendous.
It's
Yeah.
really tremendous. So today was Mars. So I work with the aspect in my chart and then I just meditate with the oils. Thank you.
Oh, good.
Yeah. Yeah, and I'm going to do the whole chakra series with you too. So
Oh, good.
I'm committed. So I have a question for you on behalf of a good friend of mine.
Uh-huh.
And by the way, I'm doing so much better. My adrenals are better. My anxiety
Good.
is really dropped.
Good.
I've got my strength back. I'm just, so great.
Good.
So my friend Sarah,
Mhm.
a very good friend of hers, committed suicide a week ago Saturday, and it was a
I'm
total.
so sorry to hear that. I'm so sorry. To
Oh,
hear that.
I know.
Yeah.
And it was a total shock to her and to his family. And so she's been in shock
Yeah.
and she feels almost like PTSD.
Yeah.
And
Yeah.
she's having a lot of trouble sleeping and her anxiety is really spiked. And she specifically asked if I could ask you what you might recommend. And I will order, send her some oils and maybe, I'm aware that hyssop is good because we use that for the, in that, but I'd love to hear what you suggest.
Yeah. So like, there's a couple of things. If it's okay, let me ask you a couple of questions. How close was she to this person?
She was very close to him. He wasn't a lover partner, but he was a very dear,
But like a good friend and close.
very good friend. Yeah.
Yeah. I mean, is she feeling that, maybe she shared this, maybe she hasn't. She doesn't feel any guilt or anything about what happened, or is she?
He feels a little guilt because the morning that he took life, he called her, but he left a message and he sounded absolutely fine.
Yeah.
So she was going to speak to him actually a couple days later.
Yeah.
So there's a little bit of guilt. Yeah.
Yeah. And I mean, sometimes when they make up their mind, it doesn't matter what you did. You know, there's not going to be any stopping. And so I would say a couple of things. And, you know, you could do like the kind of a long approach and a short approach. I would say here, let's do the short approach. I mean, it's
Okay.
just right to the heart of it. So there would be two things that I'd have her use is, one is like we were just talking about tarragon. Tarragon is amazing for shock. I mean, it is
Oh.
really good for shock, for emotional agitation, for when something upsetting has happened. Another one that could work is benzoin. That could work probably equally as well, but in this case, I'd probably lean a little bit more towards the tarragon.
Okay.
You know, she could inhale it. She could put a couple drops in water, take it internally. She could rub a few drops on the bottom of her feet. It will just take the emotional stuff down a couple of notches. I mean,
Okay.
a couple of notches. And I mean, she can go kind of crazy with it. If she wants to carry it in her pocket and just keep inhaling it. I mean, I would say rule of thumb was something like that. You know, there's different levels or degrees of shock. And like I would say that, you know, there's the initial shock, and then there's like a little kind of like lower grade shock that can last for weeks, you know, where you just are kind of stunned that it happened. And the tarragon can be quite good for that. It can even be good for that like longer term, you know, low grade shock. Rose can always be used, but you know, it's expensive, and I mean, if you have it, you could use it, but if not, I would just go tarragon, because you could, I mean, just go nuts with it. You could put you know, a few drops of water and drink it. You could do that a couple of times a day. You can inhale it. I like it for that. I use it with people a lot.
Okay.
The other thing then is she's going to be going through the grieving process. And so, you know, there's a complicated set of oils that you could use, but I would say let's just go right to, there's a single oil that works really well for this, called ginger lily. And I've used it so many times, and times where like somebody has passed, especially like when it's been, you know, not that they were, you know, it's been a shock, like it's been, you know, somebody passed unexpectedly. And it's really good for dealing with the grief that can come up with that. And even if there's some emotions of like, you know, that's why I was asking, like some low level guilt or something like that, which is very common with a suicide. Very, very common.
I know. I've been through it too. I lost my mom a long time ago, so this is familiar territory. It's, you know, today I spoke with her, and she actually was hitting some anger, which is great. Like she's moving through the grief process. Yeah, but the shock is still there.
I would
sleeping.
I would stick with those two oils. The tarragon would probably even help her with the sleeping.
Okay.
But if not, I mean, spikenard would work, but actually, you know what I kind of like for her is marjoram, or the restful sleep, which has a bunch of marjoram in it. The restful sleep has marjoram and some lavender and chamomile. And the lavender is good for nervous tension, but the thing with the marjoram is it pulls you out of the fight flight, and it also is good for transmuting like sadness and grief and things like that.
Okay.
And so, you know, you could just do straight up marjoram if you wanted to.
Okay.
Yeah.
So I'm going to suggest the tarragon, go crazy with it, everything you said. The ginger lily, and then marjoram, especially for sleep. I love marjoram. I use that
Yeah.
myself.
Oh man,
Okay.
I love me some marjoram.
Mhm.
Yeah.
Thank you so much.
You're so welcome. And if for some reason she's still not getting some sleep, let us know and we can, maybe give you some other suggestions, but that should knock it out.
All right. Wonderful. Thanks
Yeah.
again.
And again, sorry to hear that.
Yeah, it's really dreadful when that happens. It's a loss for everyone.
I would agree. Yeah.
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 Go ahead, Megan, then Troy.
Hey, Megan.
Hey, Greg. Just gonna ask you for a check-in on the thing we've been working on. If I should move on to some new oils or if I should keep.
Yeah, I have some notes on, I don't have them right here in front, or maybe I do. Let me see. I had some notes on you here somewhere. Let me email that to you a little bit later. Like I'll try to do it tonight. Yeah.
Can I sneak in another question then?
Yeah, of course.
I've been working on this for many years. It's just as simple as just relaxing the muscles in my body. I used to be so wound up, so tense. My jaw was clenched all day long. I didn't grind my teeth, but I've stopped the jaw thing, like little by little parts of it I've stopped doing. I realized I was having sleep difficulty because I could not unclench my neck. I would literally sit there and try to just unflex the muscles of my neck. I could not physically do it. I mostly lay on my back, but anyway, it's much better as I work on it. But okay. I think the trouble I have with breathing, I just can't, unless I really concentrate, take a full breath in and a full breath out. As soon as I stop thinking about it, I just go right back to like really shallow breathing, holding my breath for no reason. And I don't feel emotionally anxious. It's just like a holdover from, I guess, years of other, stress and anxiety. There's a muscular relaxation protocol in the sleep and memory booklet. So I've done that a number of times, but I don't really feel a difference. It doesn't seem, I don't know if I should do it like more frequently or yeah.
Okay. So okay, see my fingers like this?
Yeah.
And you see how I bend them? Can you see how I'm touching like the top of the palm, like the pad? Can you do that?
Yeah. Yeah.
Okay, and it touches pretty clearly.
Yeah.
Okay. And you feel like your breath is like kind of short and rapid?
It's not really rapid. It's just shallow.
Just shallow.
Like I don't like I think my abdominal muscles are just tense. I also just like as a young and self-conscious person probably just tried to suck my belly in all the time. I don't feel like I really like just relax my muscles there.
Yeah.
Probably for that reason.
Okay, so let's look at it like this. You have lang lang?
Yeah.
And you have spikenard?
Yeah.
And do you have larch?
Yeah.
Okay, perfect. In that order, lang lang, then spikenard, then the larch. You can just do long, slow, deep breaths. You can do long, slow, deep breaths and do the sinus pattern. Or if you wanted to do just like a quick version of it, you could just put your awareness on the lungs. Just inhaling it should start to produce a result. But if you really want to get involved with it, do the sinus pattern.
Okay.
Which is just like, we call the sinus pattern, but it's like the respiratory tract. It's between the eyebrows, the throat minor, the jaws, the ears,
cheek.
The cheeks. You could add like when you're on the throat, you could go to the back throat. Sometimes the bronchioles will respond a little bit better with the back side rather than the front side. But what you're doing there is the lang lang is slowing down the respiratory rate it's like, so it's starting to slow down the breath. And then the spikenard would relax the smooth muscle of the respiratory tract. There's another oil that works. I think the spikenard would be fine, but if you're not responding to this component, there's this type of basil called basil clove, and it's not. It just kind of smells like clove. It doesn't. It's not that it has clove in it, but it's really good for relaxing smooth muscle of both the gut and the respiratory tract. But spikenard's pretty good in that area. So like I'd say if you have spikenard, let's just stick with spikenard. And so that starts to relax the tissue. And then the larch will help to unwind the bronchioles and the diaphragm itself. And so go through and do each one. And then when you're starting to do the larch, do several long, slow, deep breaths. And then after you've done like maybe 10, 15 breaths with the larch, take a long, deep breath and then hold your breath and then twist side to side, like several times while you're holding your breath. And then, send her up and then exhale. And then take another big, long, deep breath and then move side to side. And, do this like maybe 3 or 4 times. And it's a way to manually relax the diaphragm. And so you're using the larch to relax the diaphragm and to deepen the breath. But like sometimes you just gotta manually like really work the diaphragm and it's like trying to take a cramp out of your hamstring or something. Like sometimes it just needs to be rubbed. You really can't rub the diaphragm. You can open up the thoracic cavity and you can work on where the bottom of the ribs are. You can even get under the ribs a little bit, but it still doesn't quite open up the diaphragm sometimes enough. And so use the larch and then after 15 breaths, like long, slow, deep breaths, and then hold it and then go side to side. And that should deepen your breath. I mean, you could do more large after that, but that's pretty solid.
Okay, awesome.
Every once in a while, there's times where we've had to do some variations, because the diaphragm can also be tied to like an autonomic imbalance. And so sometimes I've had to use like anise or like tarragon. I tend to go to anise. If there is a fight-flight issue, which it doesn't sound like that's the issue here, you could use marjoram. And so all of that is pretty solid. Then the other thing that I would say is you have this like plane of fascia on, like it kind of starts up on the head and goes down through the neck and goes down into like the upper back. And it's a plane of fascia. They call it the Nuchal Ligament. And it's not really a ligament, but it's this plane of fascia. When it gets really wound up, it causes a lot of tension in the neck. It can throw the breath off. It can throw like head posture off and how you hold your head. And it actually can even mess with the eyes a little bit because of like head position and things. And so one of the things that you can do is also take something like the spikenard or some vetiver or even marjoram. But I tend to use like spikenard or vetiver, and I put several drops on and then rub it along the base of your skull from the center and the back all the way to behind your ears. And when you get to the back where there's the little indentation where the medulla area is, if you feel on both sides there's like you can feel where muscles attach. Really rub the oil into those spots. And then after you do that, just slowly kind of put your chin down to your chest and just let it rest for a little bit. And it just will kind of keep opening that area up. And when you go through and you do that a few times, the dynamics of your head can change quite a bit.
Cool.
One of the other oils I just remembered, one of the other oils I use there sometimes is petitgryn. You know, petitgryn. Yeah.
Okay.
Petitgryn's a good antispasmodic, and yeah.
Would you do these one at a time or as a blend?
No, I would do them both at the same time. I would do the respiratory part where you did the lang lang, spikenard, and the larch. I would probably do the back of the head and base of the skull right off the bat, and then do the respiratory treatment, just because it will probably allow for the neck to relax more and a greater expansion in the upper part of the respiratory tract. By going through and doing that. It might take several tries, you know, it might not be all at once, but usually when you put the vetiver or the spikenard on the base of the skull and everything, it feels really good. I mean, it can be a little bit addictive actually. And so
my neck really would love special treatment.
Yeah. And you know, and you could rotate marjoram in there. You know, I do the same thing with marjoram sometimes, and then I'll even take the marjoram up around the ears and into the temples just to take some tension out of the head. You could rotate just to see which one works the best, but
Okay.
For the most part I tended to use vetiver up there. Yeah.
Okay.
Yeah.
Awesome. Thank you so much.
The thing that I like about like vetiver and spikenard for that application is they're really heavy oil, and they'll linger there for longer than like something that's thinner like marjoram and stuff. And so you'll get like a longer lasting effect because the oil is so thick.
Yeah.
You know, it will keep working for longer periods of time, and they're great muscle relaxers, you know, so you can put it up there and relax that muscle and then do that. And yeah, that should help that quite a bit.
Okay. Thanks so much.
So you're so welcome.
Go ahead, Troy.
Hey, Troy.
Hey, Greg. Hey,
I can
have a
I can
couple-
barely hear you.
hang on one second.
Okay, there you go. I think I can hear you better now.
Can you hear me now?
Yeah.
Okay, a couple of questions are just about oils inventory. One of them was you mentioned wild basil in class recently, and I didn't see that on the site. Is that going to come up on the site?
Do we have the basil clove on there?
Okay, so it's basil clove.
Yeah. So
It's the basil clove.
it's basil clove. Yeah. Wild basil,
Okay.
basil clove are the same things. Yeah.
Okay. And then the other thing is in the list at the front of the booklets where you list oils you can take internally, it says hops. Do you have hops oil that you'll sell?
I can get it. I don't stock it. It's a little bit pricey, and it can raise estrogen levels quite a bit. And so it's not really great for a guy to use it for any length of time. And so I can get it. Like, we can get it to you if you want. It'll probably take me a week to get it. I might have a little bit around here, but if you want some, I can definitely get it. But just don't use it every day. Like, if you use it from time to time, it's okay. But if you start using it daily, it can throw off the hormones a little bit. You know,
Okay.
for men, not necessarily for women, but for men.
Gotcha.
Yeah.
And then the other question I had was about tension in the jaw and grinding teeth at night. What do you recommend for that?
How is your sleep?
It's always been pretty poor.
Pretty poor.
Yeah.
And what's stress levels like these days?
Getting better, but
Okay.
pretty high.
Pretty high. So it's not just stress. There's been some difficulties, like in the last 6 months or so.
Yeah, I mean, I had a major relationship that I ended.
Yeah.
and
Okay.
then-
Yeah, That's enough right there.
Yeah.
Okay. So this is probably what I would do. Is there's a blend called Gilead. It's really good for cleaning up a lot of the like lower emotions. So things that are associated with stress or things that are being associated with the breakup and everything can cause some like tension in the body. And I think that could be helpful. And then sleep-wise, oh, yeah, there's something odd going on there. When's the last time you did the, out of the sleep booklet, the REM, non-REM protocol?
It's been a while.
Yeah, I think that's the thing that will help you. It will help with the sleep issue, but it also will help you resolve a little bit of the stuff going on with the relationships and things. Just being able to like resolve it and let it go, or let go of some of the hurt feelings or whatever it might be. I mean, are you pretty clear? Are you pretty clear it's done? Or are you still like on the fence?
No, it's done, and I consciously I feel good about it, and I've actually moved on, and that's going well.
Okay.
But I just feel like there's stuff in the body.
Yeah. Okay. Let's have you do the REM, non-REM, which just to remind you, it's going back and forth between Artemisia and mugwort.
Okay.
Yeah, and those are probably both something you have just from all the classes you've done.
Yes.
Yeah, just you can follow the pattern in the booklet, or just go back and forth, inhaling 10-15 times, and then the next one 10-15 times, and then just keep going back and forth several times at night before you go to bed.
Okay.
But do the Gilead. If you want to like jump on it right now, it's not quite as potent as the Gilead, but do you have mastic?
Yes.
Use some mastic. Inhale it, take a couple drops in water, rub some on your feet, and then still do the mugwort and Artemisia thing tonight before you go to bed. And let us know if that brought you some comfort.
Okay. And so
Yeah.
nothing locally on the jaw.
The jaw is a little bit more of a reflection of other things going on. Like it can be that you're in a little bit of fight flight, could be just tension from all the things you've been going through. Going through and cleaning up the lower emotions a lot of times will start to calm that down. But marjoram is always good to kind of pull the body out of fight flight, and it's antispasmodic, but it's usually a byproduct of something else going on.
Okay.
Yeah, so if you do the mugwort and the Artemisia and the thing with the mastic, that might even calm the jaw down. Yeah.
Okay, great. Thank you so much.
Yeah, I mean, sometimes we just have to start trying some things and start unwinding things, and like if it doesn't work, that still tells us something. You know what I mean? So if you do this for like a day or two with the mastic and the Artemisia and the mugwort, and you don't respond, that's a thing that we can cross off the list, and it just gets us closer to what's going on.
Okay,
so
great.
like treat it pretty intensely for a couple of days, and then let us know if it's starting to diminish. It's probably not going to be like a light switch where it's just like, I got it. The other thing that I kind of like for you as I'm talking this out, a little bit of galbanum internally.
Okay.
I like that just because even though you're in a good place and moving past the relationship, there's still pain involved. You know what I mean? Even though it's like a good move and you feel good about it and everything, there's still the pain of the past. You know what I mean? And the galbanum can help like soothe some of that pain. So as I'm talking this out, let's have you do galbanum internally and inhale helichrysum like at least once a day,
Okay.
like 10-15 inhalations. So helichrysum is good for trauma, and it's not so much that I'm concerned about trauma. I think it's more about helichrysum is really good for moving past like a traumatic event. And as a practitioner, when you're doing meditation, like you kind of are always having these little micro traumas that you're kind of evolving out of, that you're probably not even aware of. But when you have a breakup, even though it's a good choice and you feel good about it, there's still a piece that gets wounded. You know what I mean?
Right.
It happens to everybody. And so just use the helichrysum to move past the event. A lot of times it's only a couple of treatments and it will start to shift.
Okay, great. Thank you so much, Greg.
Yeah, I think that, like, especially if you feel like tension leaving your body when you're doing the helichrysum, you'll know that it's right on the money. Like if you do it and you just go, it still might help, but like if it's really the issue, you'll feel like a tension leave your body that you weren't even aware it was there.
Okay.
Same with the galbanum. A lot of times we have tension because of pain, be it physical or psychological pain, and we're not really aware that it's there until it's gone. I take galbanum internally like all the time, by the way, all the time.
Okay, I'll give that a shot. Thank you so much.
It just keeps the pipes like primed. You know, it could not even be about the relationship. It could just be wear and tear of stuff going on in the life, or things at work, or people grinding on you at work. I mean, it could be all kinds of things. It just happens. Even going through and releasing old energies, old traumas, old fears and everything, even that can be a little bit traumatic, you know, to the body, you know, because anytime you're letting go of something, the body's not usually a willing participant. You know, the body doesn't judge things as good or bad. It just goes, this is us, I'll balance all of this. And when you pull something out, it doesn't always like it. So you still kind of have to treat the body like they're trying to soothe a baby and trying to get it to go to sleep after some of these situations. Like if I do deep purifications with my purba, the next thing I do is I soothe trauma because the body's had to shift so much.
Okay.
Yeah.
Thank you.
Yeah. I hope that helps. Let us know. Like do it for a few days and then let us know.
I will. Thank you very much.
Okay.
And then somebody asked here in the chat, and I just want to make sure. Oh, go ahead. Perfect timing, Marion.
Hello?
Yeah.
Greg?
Hey.
Are you waiting for me?
Yeah.
Hi.
Hey, how did you survive those storms out there? Those were crazy.
It's just a little slushy now. Well, it's icy and slushy here. It's and it's warm. It's like spring, and yeah, they were good storms. You know.
You guys get used to those up there in the Northeast, I tell you.
I miss them. You know, we used to have really high snow, and now we don't. You know.
Oh, wow.
Yeah.
The news made it sound like it was just crazy.
Yeah. Well, it was. I mean, we got 2 feet.
Yeah. Well.
And they stuck. So.
Yeah, yeah.
So I have a new client. I have not met her. But a 14-year-old girl
Okay.
who had COVID last year
Okay.
and has not regained her sense of smell.
Okay.
The only other thing I know about her is that she's extremely anxious.
Okay. Yeah, the anxiety thing is pretty common these days.
Yep.
Do we have you seen her in person?
I have seen her, but I have not worked with her.
Okay. When you watch her and watch her breathe, like how's her breath?
I have not been that close to her.
Okay.
I don't know. But she does look anxious
She does
and
look angry.
tentative.
Does she have any other complaints?
I don't know.
Okay. Why was she coming to you for healing?
For anxiety, for adjustment, and her mother just happened to say, that she hasn't been able to regain her sense of smell.
Okay. And how long ago did she have COVID?
A year, I guess.
Yeah. Wow, that's quite a while.
Yeah.
So I mean, one of the things with that is, again, we kind of start treating and we see what happens. The thing that can be very helpful for that is the use of basil, like having them just inhale basil. You could actually even have them take a couple of drops internally in water, or take a couple of drops and put it on a finger and then reach in the back, like the back part of their tongue, and then like kind of swab the back part of their tongue so it kind of goes up in the soft palate, back in the back of their throat up into the sinuses. That can be helpful, but a lot of inhalation of the basil. A lot of times over a period of time, that can bring the sense of smell back. Because it can be just like inflamed nerves. It could be nerves that have like dulled in their function. And the basil would reduce the inflammation and stimulate the nerves firing. And so that's a pretty solid choice right off the bat. You can always have her do that and then do, healing on it after she's inhaled several times.
Yeah.
And with that, I would clean the nostrils and then clean like the sides of her nose, like, along the little, like that little crease. That will help to open up the sinuses. In the old days, in my younger days, we would put a glove on, like lube up the finger and kind of go in and manipulate the nasal passages a little bit. And so you're kind of trying to do that with basil and the healing. And one of the things that when the sinuses aren't functioning super well that we forget about is the roof of your mouth. And you could use bay laurel. You could probably even get away with basil there, but I would probably use bay laurel. And again, you could do it a couple of different ways. One way that I used to do it therapeutically is, again, I would glove up, I would put several drops of bay laurel on, and then I would get in and just like kind of massage the roof of the mouth. And even when people would be super impacted, their nose would open up, like while I was doing it, and we would get spontaneous. They would start having the sense of smell almost like in the session. It didn't work every time, but it does work sometimes. And if that's not really an option, take 3 or 4 drops of bay laurel and put it in water, and you could put just like a pinch of salt in it, You can. Like the salt, I mean, it's helpful, but it's not like a deal breaker. But then have her like, not necessarily gargle with it, but get it in her mouth and just have her just like swoosh it around, but for a really long time, like as long as she can handle it. Another way to do it instead of using water is you could use sesame oil. Like, you know, put a teaspoon of sesame oil in with like 3 or 4 drops of the bay laurel, have her put it in her mouth, and then, you know, start swishing it around. And then when she's done, you know, have her spit it out. That will stimulate the lymphatic movement on the roof of the mouth and really be a game changer for the sinuses.
Okay, how often?
She could do it a couple times a day. Yeah.
Okay, so
Like the thing that I would be curious about with that is has her gag reflex changed? Like, does she feel like it's easier to like gag, or it's quicker to where she could start to feel like she's going to throw something up, or, you know, where before, you know, she could put something in her mouth and she wouldn't gag, but like sometimes even like if they even have like toothpaste in their mouth for just 30 seconds or something, they'll start to almost get a gag. It's the roof of the mouth. Like the roof of the mouth is really stagnant with lymph and probably even inflamed.
mhm.
The thing with COVID is, you know, I should say this version of COVID, because, you know, COVID's been around since 2005. It causes a lot of bizarre symptoms that like seem unrelated.
Mhm.
And the thing with the nose and the roof of the mouth and all of that actually could be a byproduct of that.
Okay, that's a lot to go on.
Yeah. I mean, those are pretty solid treatments if you can get them to do it. That right there, I mean, 9 times out of 10 will produce a result. I mean, there's always the one time that it doesn't, but that's pretty solid. And then if you combine that with you doing healing on her and everything, you have a pretty solid shot at restoring that, and probably actually relatively quickly.
Yeah, and if I'm going to do pranic healing also.
Mhm.
I think that would, and I'll go to the same areas
Yeah,
as well as
like literally sweep, like you would be doing general sweeping, like do little zigzags on the roof of her mouth and rotate between green and violet.
Yeah.
And medium green, medium violet, like
Oh.
lower the vibration of the energy, because when the lymph is stagnant, the vibration of the body goes down quite a bit. And so by lowering the vibration, you'll produce a quicker result.
Mm-hmm.
You know, eventually you can raise the vibration, but at first, part of the issue is that sometimes your energy projected is too high a vibration for like an ill body, and so you have to kind of lower the vibration for a little while. I mean, in really extreme cases, even use dark for a little bit, you know, just for a little bit.
Mm-hmm.
But yeah. How's your foot doing, by the way?
If I stay off it, I'm fine, which is kind of discouraging. I can go back on the treadmill for maybe 2 miles, but if I go longer than that, and I was going 4 every day, so, you know, I just got inserts. We'll see if that helps. I did get the little socky thing that pulls the, you know, flexes the foot, and that's great. It's better. It was really inflamed when I started, and now I can feel it pulling. My arches must have
Okay.
dropped or whatever they do.
How long have you been doing the little brace?
A week and a half.
Yeah. Usually 2 weeks, you should see pretty significant difference with the brace.
And I should do it even if I'm not feeling discomfort?
Yeah, I would do it for a little while until the foot just really calms down.
Yeah, because the arch itself it feels like it's a little bit thick feeling, like it's
Yeah.
inflamed.
Yeah.
And my favorite of all the drops is chamomile on it.
Yeah. Oh, is it really? Nice.
Yeah.
Yeah. Nice and soothing. That makes sense.
Yeah.
Yeah. And anti-inflammatory, soothing to the nerves.
And walking on the tile bathroom floor, it's cold.
Yeah.
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 So I'm
Well, good.
hoping it's better. Yeah.
Good.
Thank you. I'm looking forward. I see you're advertising for your visit out here.
Yes.
I'm looking forward to it.
Yeah. Not too far away, really.
No? No? Okay,
Tell Dave hi for me.
I will. Yeah, thanks. Hi, Sam.
Hey, Miriam. Tell Dave I say hi to.
Who are you saying hi to?
To Dave.
Oh, tell Dave you say hi to. All right.
too.
And then we have about 7 more minutes and we do have some stuff in chat, but if you want to unmute yourself, you can as well. Someone said, I have a client on a lot of maintenance cancer meds. Recently was hospitalized for water weight. Well, at the hospital, she lost 30 pounds of water weight in 1 week.
Yeah.
She also has pain on her feet. Any specific pH protocols? I'm also having her put galbanum and CRC on her legs and
Yeah.
feet.
So like any time where there's a lot of water retention and there's pain, I mean, you can do some things for trying to maintain or manage the pain, but really probably the source of it is actually the water retention. And so the thing that I would do is, she sounds like she's on meds, to diuretics and things to get rid of the water weight and the fluid retention. I would also probably support that with some essential oils, even though she's on meds. Most people could stand using a little bit of like a kidney flush from time to time. And so the hardcore version would be to start with sandalwood, and then after that go to parsley and then lovage. Since she's already on the meds, I would say, use parsley, and then after parsley for a week or two, and then maybe switch over to lovage leaf. It doesn't have to be the fancy lovage root. It could be the lovage leaf. And the lovage really helps the kidneys to function better. Still a bit of a diuretic. The parsley, very good diuretic. Sandalwood is a really good diuretic as well. The sandalwood works really well because it can break up blockages in the urinary tract and in the pelvis and things, and also in the lymphatic system and then some of the veins. And so if it's not responding to those other things, you could go back to the sandalwood, but that they gave her diuretic and she lost, or the person lost 30 pounds in a week. I think it just needs to keep stimulating the kidney function and the use of diuretics. And so I would support it with parsley and lovage. I would probably put 10, 12 drops like on the wrists and like rub the wrists together and do it once or twice a day. If you don't want to do that many, do 6 and then maybe divide it up 2 or 3 times in a day. And then you can do the same with lovage, and just even putting it on through the skin will actually help to reduce. And then the other thing that I really like to do with something like that is take you can go to the drugstore and get a bottle of witch hazel, make sure it doesn't have like a scent in it, like it's an unscented form of witch hazel. And then take a bottle of cedar, like either a 5 ml or 10 ml bottle. I mean, it's going to be strong. And then just, pour a little bit of the witch hazel out, and then, like a 5 mils worth, just so you can put all the cedar in it. And you'll have to shake it up really good every time you use it, but have the person really shake it up, and then cover their legs, from the feet all the way up to the hips and even into the low back and abdomen. So that has a little bit of a diuretic effect, but the thing that it's really going to be good for is venous circulation, which is moving blood back to the heart. And so it's very good for vein support and just getting fluid to move up out of the legs. And so that combination actually should be very helpful, very supportive of that. Just doing this should actually reduce some of the pain. They're not necessarily pain relievers by themselves, but by reducing the fluid retention, it should reduce some of the pain. If there is some pain management that you'd like to do, anytime there's pain, you can always go to a mint, like peppermint, corn mint, something like that. Here, I'd probably use birch tar. Very good pain reliever, still lymphatic stimulant, and helps keep moving the fluid out. And so a bit of a diuretic, not quite like the parsley and the lovage, but would just keep moving everything out and is very soothing and helps reduce pain, especially achy pain. If it's sharp pain, use the mints, like peppermint or corn mint. But if it's achiness, use the birch tar. Yeah.
And any pH?
Do the blood purification, heavy emphasis on the kidneys. Lots of green, lots of orange on the kidneys.
How many? 2 minutes. Okay.
Mm-hmm.
Is there a substitute for ginger lily for grief?
Yeah. There's that blend sadness and grief. You can mix rose, cypress, and marjoram together, but ginger lily is the strongest. Yeah. The ginger, rose, and cypress together is pretty strong as well. But just as far as a single oil, marjoram can be helpful, but the thing that works the best is the ginger lily. Yeah.
Can you take restful sleep internally?
It's actually best inhaled or through the skin. So there would be no real benefit to taking it internally.
And that is it for the
if you wanted to do something like that where you wanted to augment the sleep and take something internal, just take some regular marjoram, like take 2 or 3 drops of the marjoram and do that, and then still inhale the restful sleep and put 6-8 drops on your wrist and rub it together and do that. Yeah.
Thanks, guys, for joining us for the Q&A. I know usually I put in the angel link here on my, but it is right below where you got the link for the Q&A, and we'd love for you guys to join us now for the angel practice if you would like to join us. But we need to step out and go over.
Thanks, you guys.
Thank you.